Very good morning to all of you. And I thank, what can I say, is my daughter or my granddaughter, Dr. Satya, and the whole team here for giving me the opportunity to be here today. This first visit, I was here for the Bhumi Puja, but for the inauguration, I could not make it. And this is the first time I'm visiting Tirupati, and I'm so happy to be here with you all. So when I was given this topic, I was taken keen interest to know for myself what it is. I know how I learned, but I wanted to know how the world learned about orthoptics. It's if you go at the history, strabismus per se was recognized as a permanent deformity. So they thought there is no cure for the thing, so no treatment is suggested. That was very ancient days. But by 7th century, it's all that the development, strabismus and the orthoptics happened in France. And that passed on to UK. And then later on to US or other European countries. That is how the history says. So 7th century, the Greek said, use of a mask with the perforations will make the eyes straight. That was the first treatment suggested. But that later on, 2-3 people advocated the same management, but only in 17th century earlier, again, a French ophthalmologist described squint as arising from a deformity or defect in the retina, deviating from the form of ocular. See, same slide. Same slide only. Display in this slide, history. Oh, I'm sorry. Why it's not coming? Okay. Which one you said? No, I can't do it. Here, I can do this here, no? Yes. Yes, okay. So that followed in 1743. This Buffon, they say this is a great scientist, and he recommended that the good eye to be reduced, the vision should be reduced so that the squint eye can be forced to use. It was the first time he said that part-time or anything that reducing the vision in the better eye will improve the vision in the squinting eye. But only this Darwin, an English scientist at that time, advocated the same therapy, occlusion of the eye. This is the first in the history suggestion of occluding the normal eye happened. So what is it? I was going through, this was also again interesting. A Greek word, orthos, straight, optikos is something pertaining to the eyes. That is how they coined the word as orthoptics in the literature. But that appeared as early as before 19th century. But then orthoptics came a little bit later, only in 1930 or 40s. And first, his Javel was recognized as a father of orthoptics. Again, a French person. See, interestingly, he was only an optical engineer, but he turned out to be an ophthalmologist also. And then his interest in strabismus went because his father and sisters were strabismic patients. So he thought he should do something to treat them. And then that is why he invented a stereoscope. What is it? Javel's grid. This is the reading grid so that they can use both eyes to read. But he suggested to have these exercises for at least for 16 hours per day. And then he said 12 to 14 hours per day. And then that goes on for days together. But at the end of his practice, he himself said, the humans are not worth spending so much time to get this to be treated. There must be something else to be done later on. And also he said, if you're done before the age of 6 years, even for a lesser number of hours, it may be useful to regain the binocular vision. But the problem is he taught people, he wrote manual only in French, but they didn't reach the English people. So there again, his disciples on migrating to other parts of the country, other parts of the world, started doing his own investigations and inventing scopes. And this is his called Priestley-Smith tubes. It's only two separate tubes what he used as a earlier stereoscope. And this in later on his tube was called heteroscope, and this the same thing. Different physicians said prisms can be used to induce these eyes to be used together. So it's the first time in 19th century, very early, they said prisms can be used as early as 19th. And this is the time. I know all these instruments, I have seen it. It was, I think Rama must have seen it. Muthulakshmi, I don't know, but I wanted to search in my museum, it was not there. The Remy, the student of this Javel, he took this knowledge to England, and then there he started innovating instruments. It's called Remy diploscope. And then this Remy separated. He is the one who realized that there is a suppression. Javel didn't realize there was suppression is going on in squint. But he is the person, Remy was the person, realized that the suppression is going on in a strabismic patient. So there must be something to separate or make the patients realize the suppressed eyes to see. So he developed this thing with the septum in between so that you can see on even this. I think now Jitendra has done a little bit different thing. This and with the stereoscope that will come later on. He has developed different thing, but with the, based on the same model. Say as early as 19th century, it has been invented. And this is the again another stereoscope with a little bit more refined stereoscopes. Why this Donda stereoscope was important was only based on that the remaining the next innovations came. And this is, we all know, we have been talking about Watts. This is the same Dr. Watts, this is England, and he invented this amblyoscope. What amblyoscope it is called? It's as early as 1903, and this with this he advocated exercises, and he is the one that he said he should do prescribe glasses for these children. So psychological refraction is a must for these children, and then accrued the fixing eye. Also, he as early as that he realized that atropine can be used for penalizing the normal eye. So his inventions has been a major advantage in history of orthoptics. And you know what Fodart, and he is the one who described this anomalous retinal correspondence. When you say anomalous retinal correspondence was realized very early, 18th century itself, but there was no proper diagnosis and management of this. We'll talk about it a little bit later on. But he also advocated, because the Javel's teachings didn't reach England, he also said simultaneously this treatment will work much better in younger children. So how this orthoptics and then orthoptics came into the field. But Eccles in England, he is the one introduced synoptophore. It was called a synoptoscope for some time. And this is the later version of Watt's amblyoscope. That's why it was called as major amblyoscope. And he used all sorts of slides and targets for exercises. And they started practicing in London optometry school. Not orthoptists not developed. Optometrists have been using this stereoscopes and synoptophore also, because the public demand was more for getting treated for strabismus. And this only stereoscope and this did not much treatment was going on that time. And it was Maddox. You know this Edmund Maddox, you have a Maddox rod, you have Maddox wing, you have stereoscope, so and Maddox scale. So many instruments he has invested it. And I have personally seen, when I was doing post-graduation, I have seen this Maddox wing being used and stereoscope also being used. And we also have used it in the department for quite some time. But later on, it is not in use now. You can see the child getting treated, and then interestingly, it is Maddox, being a very busy ophthalmologist, he didn't have much time to devote, though he innovated all the instruments, he was finding it difficult to devote his time to a child because it takes a long time. His daughter, Miss Maddox, who was then acting as a receptionist, got interested in learning the skills in examining these children, and then quickly she learned it. And she had contributed so much to the field of orthoptics later on by forming societies, boards, and all those things. And she was recognized as being the first orthoptist in the world. And that means orthoptist, in the literature it says, orthoptist is the one who could investigate, diagnose, monitor, and treat defects in the eye movement and problems with the eyes on working together. This is what in literature says in early 19th century. That means Maddox was recognized as orthoptist. And this was the many different accrueders were suggested that time. You can see that Miss Mary Maddox is there on the thing, and she was the one started thinking about forming a school for training in orthoptics and orthoptic clinic as a separate facility. And so her name comes everywhere in the literature. So what happened? What was the further development? So how this World War II helped in further developing orthoptics is very interesting when we read it. They said the Keith Lyle, I think all of you know the history, the older books are there written by Dr. Keith Lyle, is an ophthalmologist, and his orthoptist, they said they could say the type of phoria the pilot has and the method of landing. See, when a pilot having exophoria lands little bit smoothly because he could control that exophoria during that, at least for their landing position. But the pilot who has esophoria and on looking closer, he feels the distance, anticipates the distance of landing too quickly and then end with the bumping landing. So that much learning, precise thing they thought about landing, and they thought there should be something to examine these pilots for night vision phoria and then somebody to treat them, to recover them, to have better pilots. And more orthoptist schools, everything developed for that time to train them. And then they were also recruited, especially in seeing binocular vision, other things. And you could see this all in the history, it says all the stereogram slides, RAF ruler was developed that time to check convergence and accommodation, mainly for the pilots. And then that all the stereogram slides, what you see, only with the parachutes and airplanes, these are the slides they were using it for checking for pilots. And that came the sketch screen by Clement Clark. It's just a cloth screen, and then you can see this bar reading. I don't know how many of you are familiar with this British bar reading. I have had one. I was gifted one in 1990s, and we used it for quite some time, but then it just is gone to the museum. And then how the training happened. And then again, France was the forerunner, followed by the British. And here, the criteria was the candidates must have finished schooling, 1 year training. At the end of 1 year, they should take exam and they should pass. So both ophthalmologists and orthoptists will be the examiners. And that is how the orthoptic school started, mainly in England, one school, but again, more fields, as I say, Westminster Hospital, and then it went on to many other schools. Simultaneously, it went on to the USA and other countries also. And post-war, what happened was, many orthoptists from England started migrating to other countries, like Australia, USA, almost all countries, including our India and Pakistan. There, they started practicing or teaching and also training, developing schools for orthoptics also. And meanwhile, many countries formed their own orthoptic societies. First is in British, France, and then the British, but all other Australian, so many, Germany, everybody had orthoptic associations, except Japan, which was a little bit late. But what happened in America was, again, the first orthoptist trained for USA was from Britain. So she developed that orthoptic schools in, I think, first thing was in New York, and second thing was developed in where I was trained as Chicago, Illinois Eye and Ear Infirmary. The orthoptic schools were, and then many schools came in simultaneous at time. So again, this society and boards also, they have initially they named it as American Orthoptic Council, and they called orthoptics as orthoptic technicians. And later on, they said Association of Certified Orthoptics, and this is still holds good in there. And then they are coming with the journals also. But British Ophthalmic Journal came in 1939 itself, but it somehow it just didn't continue. But this American Council is continuing, and then this they have so many awards, and still it's going on in the country. Well, yes. And how I learned orthoptics? I learned orthoptics because I was very raw when I finished my post-graduation. Started when Aravind Hospital was started 76. I was only 4 days after my post-graduation, and there was nobody to teach me on orthoptics, but I was given the subspecialty as to manage strabismus. But our founder realized that I need more training. So what I heard that there is somebody from Sitapur, somebody from author, Sushil Vora, you know. Still, no, I saw that few years back. Is she there? She's not there, but she's still, she's alive, you know. And she, Dr. Mehra, who was the founder of Sitapur chain of eye hospitals, was kind enough to depute Ms. Sushil Vora for 3 months to come to Aravind to teach me on orthoptics. 1977. Sitapur is very well known for orthoptics, and they had a training for orthoptics school also. And it was 3 months I had a training with her, and she taught me about even from the basic of synoptophore, what to use, all of those things. Synoptophore is the only one that time we had. Synoptophore, hemiseparator, Maddox wing, Maddox rod, all those things we had it. And then there's one German orthoptist, she came and stayed with us for 3 months. She taught me 1978. It is orthoptics. It was my basic training in orthoptics in 77, 78 before I went to America for learning more. And then later, 85, my mentor in America, Dr. Marilyn Miller, realized that I need more refinement in orthoptics. He started counseling on Dr. Miss Joyce Main. She was the principal of University of Leeds Orthoptic School, and she was the one involved in teaching in Australia, other countries, that I came to know only on reading this history. I didn't realize that she is that much big head when she was there with me. And she was there 3, 4, 5 years consecutively, every 3 months in a year. And she used to teach our own girls in orthoptics, because I was a busy surgeon, that she was teaching our girls in orthoptics. And we wrote a manual together. And with that thing, see, that is the time I was learning to use prisms. How to use prism, she is the one, she's Jasmine. She was the one teaching me on how to use. The first time we got the prism bar, loose prisms were not available that time. We had only prism bar, and she was using even to hold, how to hold the prism in hand. And the next picture, what you see, this is that in 1986, there was a International Orthoptic Association was already formed there. And then she is the one instigated me to put a paper. My paper was on accommodation anomalies in young population. This is Cori, the leading cause for settling in early presbyopia in Indian population. So that was a great paper. It's the first paper for me in 1986 in orthoptics. And the gathering, you know, about 3,000, 4,000 gathering. And then the Prince Annie was the chief guest that time. I was overwhelmed to see the first time international meeting. So many audiences were there. So really I was a little bit scared to present the paper, but everything went on well. This was at the dinner, we were relaxing at the dinner that time. First international meeting, I traveled alone without somebody to help me. And later on, almost all the presidents of International Orthoptic Association had visited Aravind Hospital. And Susan was one-time president. Daisy Gans was one-time president. And Bruce Fur, again a big person. And you see, we had a meeting on Orthoptics Decoded. I don't know, Satya knows about it. I think before Satya came to the department. You were there? You were there. So Muthulakshmi must be knowing it. So we had all these teachers teaching, upgrading us on what has been going on in the field. And you can see Bruce Fur, suddenly you can see Kumar there as somewhere I saw Kumar. And Karin, she is now the present president, and she is the one when I wrote to her saying that I am asked to talk about the history of orthoptics. She is the one gave me referral to read, and then from there only I took all these pictures of history on orthoptics. Karin, she is still, we are working together in our international orthoptics training. And this is what our practice was. We had 1978 started as a small clinic, as a school clinic. I also was functioning only at the part-time. Morning, I was involved in general ophthalmology. Afternoon, I will go to skin clinic, practice there. And that later on, it went on to full-time pediatric ophthalmology. And what is now association meetings, I think all of you should be aware. I don't know how many of you are subscribing for this orthoptic journal. In Madurai, we are subscribing the journal, and then we have that journal that talks so much about your accommodation convergence anomalies, which I think all of you should keep knowledge about it. So in the second meeting was, that time Joyce Main saw me seeing so many children with amblyopia in aphakia. She said, why don't you present your experiences in our next conference? So when I wrote a paper and then that got accepted, that was in Melbourne. So it's not, you should not restrict yourself only to strabismology. There is so much you can learn from orthoptics. When you sit together with them for 2-3 days, and then looking at all the posters, everything, definitely your knowledge in orthoptics will imbibe very easily, and then that you can learn it very quickly also. There's one opportunity, I think all of you should make use of it. So before the summary, I just wanted to read something about ARC, how ARC was recognized. If I didn't put it in the slide. Light. Yes. Yes, it's okay. No. While abnormal retinal correspondence in squint was first observed by Johannes Muller, you should have seen many papers, references about Dr. Muller, in 1826, and continued to be studied by von Graffi, Hering, Helmholtz, Belshowski, and many others, mostly Germans. It is only quite recently that it has become a practical problem in the treatment of strabismus. The major amblyoscope has played a very larger part in bringing this concept from the research laboratories to the orthoptic clinics, because the instrument constituted the first practical method both for making the diagnosis and for carrying out the treatment in children. So probably the first time in the country they developed solely for orthoptics as organized by Dr. L.H. Hardy and Mr. Stark. That was in USA. In all those, then whatever I have told, that is developed in other countries. But now in India, what is happening about orthoptics training? I could search, Google search, I was searching. That is the reason why we were asked to train orthoptists by the Orbis towards developing more pediatric ophthalmology teams. We have developed many tens of orthoptists for them, both for the country and for the international people also. Because these schools of training is becoming less and less parts now. And whatever I could trace, it says one Sittapur Regional Institute of Ophthalmology, Sittapur, is conducting regular courses, but the graduation after +2 schooling, and then one in Gandhi Eye Hospital in Bhopal is conducting courses. I don't know in Calcutta, are there any courses for designated course for orthoptics? Nowhere else. I could search. I asked our librarian also to search for it. She said, Madam, it is nowhere it is said. So I think all optometrists here, I think there was some politics was going on between optometry and orthoptics, and it just got stuck there, getting a separate course. But optometry, once you become optometry, like optometrists going, not only are doing refraction, they are doing patients with the low vision, they are doing with high myopia for LASIK procedures, and they are also for treating strabismus patients also. So in that way, your pursuance, your interest, if you could develop that interest and passion in doing this, and then definitely we can teach more and more younger generation to become more good in orthoptics. Because earlier when we were students, we used to keep away from that orthoptic room. We never get inside that orthoptic. The orthoptic room will be quite a large room in a consultation room. It used to be in government hospital 3-4 times more than the consultation size. Every time 4-5 children will be sitting there, and there will be 4-5 orthoptists. They will all be working on synoptophores. So we are so scared about this synoptophore that time when they are learning. And they also were not in a position to teach doctors about what is going on. Whenever we go now, yes, doctor, what do you want? You have a patient? No, madam, I just want to see. I think he can come later, doctor. That's all we used to hear from them. We never were allowed to enter inside and then see what is happening. I think that is how the knowledge, the fear, even under our postgraduates, that the fear of understanding binocularity, the fear of understanding what is happening, that makes them restraining them from taking the specialty. I think if that is made easier, even undergraduation course, optics and orthoptics, I think more and more ophthalmologists will take up the specialty. That is what I expect all of you to do it. And whatever we have done, we have done. But as Satya showed this slide first, it is so much working with the children, and orthoptists per se, what are they? They are the ones designed to see these wiggling infants. It is not that easy. Even though in our practice we say it's difficult, I used to say, Muthu, this patient is very difficult. You just measure everything and then let me know. And then maybe finally I just confirm it. That's all. But where is that kind of a passion, that kind of a devotion, examining whatever the child is difficult? They never say child is we can't not cooperating, madam. I don't like that word. My staff also, they don't say that this patient is not cooperating, but they somehow they get that done for that patient. That is what that we want, and that is how that we need to work as an ophthalmologist. We will not be able to pursue everything on our own, and then when we work on a team, I think we make a successful team and successful profession in future. Thank you very much for your question.